Welcome, everyone, and thank you for joining us on this lovely day. As we begin to reopen, I think we're all very eager to learn more about this topic. It is thriving post-pandemic, the implications for your mood, your microbiome, and your cardiovascular system. Today's presentation is presented by Dr. Paul Urkel. My name is Dr. Navneet Nibber. I'm a medical advisor with AOR, and I will be the host and moderator for today's presentation. Before we begin, I would like to go over a few housekeeping items. There is a question and answer session at the end of the presentation today. And if you have any questions throughout the presentation, feel free to look at the side screen. There should be a questions tab on the right of your screen. You can just drop in any questions throughout the presentation. If it doesn't get answered during the presentation, please keep in mind we'll address it at the end. And please note that this presentation is being recorded for future distribution. So the content of this webinar has not been evaluated by Health Canada or the FDA. It is very much meant to be educational in nature and should not be taken as medical advice. We always want you to consult a qualified medical professional and to see if a diet, lifestyle change, or supplement is right for you. Any of the supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests and myself are of our own and may not reflect those of Advanced Orthomolecular Research, Inc. So now that that's out of the way, let's meet today's presenter. Dr. Paul Urkel is a board-certified naturopathic doctor practicing in Toronto, Ontario. Dr. Urkel is uniquely positioned to speak to holistic wellness as we come out of this, as he has a clinical focus on neurological health, chronic pain, brain injuries, and is also heavily involved in teaching and education. He frequently writes and lectures to both healthcare professionals and public audiences. He is the medical director at Advanced Orthomolecular Research, and he's really bought this chief mandate of sharing scientifically supported natural medicines and formulates effective natural health products. So we're ready to begin. Without further ado, I will hand it over to Dr. Urkel. Welcome, and thank you so much for joining us.
Thank you so much for the great intro, Nirat. As always, pleasure to be with you. Thank you again for everybody joining us today. I have to say that this topic, and I do a lot of webinars, this topic is one that I'm probably most excited to talk about. And it's one that I hope that you share with a lot of your colleagues. It's one that, everyone that hopefully after you listen to what I have to share with you today, you'll be able to share the recordings that are available on AOR's website. And I'm going to show you the link in a couple minutes, because I think this is the most important thing that we're going to be dealing with our friends, colleagues, our workplaces, the ramifications of this pseudo lockdown that we've been part of. And I think that the impact that I started looking and seeing in the research and as well as in my patients really was not an ideal situation. And I think this is going to be very abundantly clear by the end of our presentation. So I hope that you're going to enjoy what we have to share, but because I really enjoyed putting this together, and I really think that it's going to be something very valuable for us to know. Obviously, the customary disclaimers, Dr. Nibber has already gone over that at length at the beginning of our presentation. So I modify this plan a little bit today. So as I always do before doing a presentation, I always review my slides, and I decided to focus a lot more on the first 2 points. And the blood flow and cardiovascular function, I will mention right at the end. The slides, the handouts that you have in your little box on the side there, those are the old slides and handouts. So there's a lot of information there that I won't have time to go over, because I do want to spend a lot of time on the mood and on the microbiome, because I think this is where so much of what we're going to be dealing with is going to be taking place. I will touch on the blood flow and cardiovascular function, but anybody that has the slides and has the handout will already have that information, so consider it a freebie to have all that extra info. There's some great resources I wanted everyone to make sure that they have access to. First and foremost, the last couple of months, we've been doing a lot of work and webinars focused on the immune system. So I did a webinar back in the end of March, beginning of April on that. And then one of our other medical advisors, Dr. Chantal Dumas, she is a naturopath based in Quebec, and she did a great webinar on the gut and GI function. So the first part of my presentation is on the microbiome, and I'm going to be referring back to this webinar. So I encourage everybody that's listening, go back and listen to this webinar, because I think you're going to get a lot more information about the products that I'm going to be mentioning there. I just presented the nootropics for optimal cognitive function webinar. That was last Tuesday. That's available for viewing and downloading. So please go back and check out these two websites. It's important to understand everybody that's on this presentation, I'm assuming is either a nutritionist or somebody that works in the industry. Our public presentation is going to be occurring for nootropics next week. But there's two different websites for you to go to, just so everyone understands. The information that I'm presenting today, which is more focused on healthcare providers and industry, is different than we're going to be sharing with the public. You're going to be getting a lot more information in the B2B webinars, that's business to business webinars. So I want to make sure that everyone understands the two different URLs where they can access presentations and webinars. So obviously there's no COVID treatments here, customary disclaimer. Okay, so this is something that I started thinking about a lot, and I don't know if you have, and if you have, please share in the chat, and we're going to be answering any questions at the end of this presentation. But I started thinking, okay, so now everybody's talked about their immune system and COVID, and we're coming out with all these different, I'm sure you're all seeing them, YouTube videos, them being censored, all sorts of issues with how are we going to tackle this virus and our immune system and the response to it. But now that I've shifted away from that, because now everybody's presenting on that, I started thinking about what are some of the downstream effects of being in this quote unquote lockdown, using Lysol wipes on every single surface multiple times a day, touching them, then putting that in your mouth. What about the impact on our children? What about all the impact of all this excessive sanitation? I mean, the thing that really jumps out to me is when you see these pictures. I'm based in here in Toronto, so this is, thank God, not happened here. But in other places around the world, you see these people in masks walking around just spraying things. And obviously the first gut reaction there, and pun intended, I think, is, first of all, that is not probably a healthy thing that you should be breathing. And what's the impact on the environment? There's reports just already coming out, in Spain, they were spraying diluted bleach as part of this kind of COVID disinfection, and they were spraying it on beach, and the ecological impact for the ecosystem is going to have a really, really detrimental effect. So this is where I want to start this process. So come along with me on this journey as we understand the long-term effects of ultra or hyper sanitization. So I want to take a step back here, and maybe some of you have already seen this before, but there's this term in the literature that is called the hygiene hypothesis. Some of you may have already heard it, but it really has come around, and this connection and this almost this dichotomy between the decrease in a lot of these infectious diseases and the increase in a lot of the autoimmune and these allergic diseases. You can actually see them quite clearly on the right side here. Type 1 diabetes, asthma, Crohn's disease, multiple sclerosis, they were very low before the 1950s. And now those numbers are skyrocketing, where you definitely see the opposite correlation with, hepatitis A, which is a very harmless form of hepatitis. Obviously, mumps, tuberculosis, measles. These are all things that were big issues in the past. But then we have this, sanitation, and you have obviously a lot of changes in terms of cleanliness and hygiene. But then as that hygiene started occurring, what was the potential downstream effect? And so researchers have been looking at this for a while, and this is a journal in the New England Journal of Medicine in 2002. And they started postulating this question: could there be a connection? And then as the years went on, this is a paper from 2017, which I thought was really, really, this graphic does a really good job of describing what happens, especially as a child grows up. What's the influence on their immune system, which is what we're all talking about right now, the immune system, all the different things that they're exposed to. The first 7 years of a child's life is where majority of the immune system and their tendencies are set. And in fact, the microbiome of the baby, the infant, is set a lot by what the mom does and their first years in this world. And so what they found is that anything from close contact to animals, antibiotic use, whether they're breastfed or whether they're fed by formula, the mode of delivery, so cesarean section versus vaginal delivery, makes a huge role on the microbiome. Cesarean section, for example, massive increase in atopic disease, which is allergies, and some of the conditions I just showed you on the previous slide. And then finally, family size, sibling order. So single kids, smaller families have a less diverse microbiome. And so I want to show this to you in the next couple slides, but all these things contribute to the baby's immune system and then lifelong immunity after that. And so the evolution of the hygiene hypothesis is that, well, it's not actually all hygiene. It's not whether you're exposed to, a hyper sanitized environment only, but it's also the impact on the microbiome. And so I thought this was a great little title. Hello, microbiome, my old friend. How a diverse microbiome trains the immune system against allergies. So it's not just if you're living in a bubble, so to speak, or if you have one sibling or no siblings. It's also about what that has an impact on your microbiome. And your microbiome, what it does is that it creates this regulatory system. And in the immune system, it's called the Treg cells. And they control the way the body responds to different things it finds in its environment, whether it's food, which is here you can see milk, or peanuts, or bee stings, or pollen. And that is going to dictate the long-term exposure and long-term incidence of allergies and autoimmunity. So now it's not just hygiene, but it's also microbiome. There's this balance between immune resilience and immune tolerance. You've probably seen me talk about this before if you listen to any of my other webinars and presentations. So the microbiome is front and center when it comes to regulating immune tolerance and intestinal homeostasis. And so I guess the question that we have, especially in this time when we're hyper sanitizing, is what is this hyper sanitization doing to everybody, especially our young children, where again, you need some sort of exposure to bacteria, to viruses, to parasites, to furry pets, to other siblings putting their snotty fingers in their mouths. I have 3 kids, so I'm acutely aware of that. And so the more that we have these healthy exposures, especially early in life, the more diverse, the more normal our microbiome is. So the proper term now in the literature is going to be kind of like a microbiome or microbial diversity hypothesis, sorry, or the old friends hypothesis, where we have more bacteria, 10 times the amount of bacteria in our guts than we have in our body. So this is really important to consider. And the one other thing, especially as it pertains to the context of what we're going through right now, post-pandemic, and as things open back up, this is a great little graphic. Don't worry about all these different receptors. What I want you to focus on the bottom here. This is dietary fiber, and these little black things right here. These are our bacteria. These are our probiotics. And what they do is they're producing these little orange squares. These are called short chain fatty acids, and they are fuel for our gut lining to keep it nice and tight. They are fuel for our Treg cells, our immune system cells, our neutrophils, monocytes. But look, they're also following the bloodstream, and they also end up in the brain. And specifically here, what I wanted to really showcase is that when our gut microbiome is diverse and producing adequate amounts of short-chain fatty acids, like butyrate, for example, it is less predisposed to addiction, neuroinflammation, depression, learning and memory issues. And so put that into context of all the things that we're experiencing right now as we are being socially isolated. We are almost creating an environment where, like a child that has no siblings, is going to have less diverse microbiome. So we have to think about that. also think about the excessive use of antibacterial soap. So now, and this is something I lectured when I graduated about a decade ago about this whole thing of triclosan. This is an antimicrobial substance that was used, and it was linked to a lot of allergy. It was actually linked to a lot of negative health issues. And probably in the last 5 years, most companies started taking this stuff out. But for the longest time, all the liquid soaps, many other household products had this triclosan in it. But there are other things that are also now being exposed to that maybe isn't exactly triclosan, but it is other antibacterial substances. I'm talking about things that are not just standard 70% alcohol. Specific antimicrobials, there's many on the market. So we don't fully know the effect of all these things that we're possibly putting all over our foods, putting in our mouths, putting on our substances. And we do know that there is a link between household cleaning sprays, like this study here shows, and adult asthma. Just using common non-professional household cleaning products was associated with new onset asthma in adults. So something like that now, and I'm seeing case reports, and maybe some of you are seeing it too, case reports in the media, in medical journals showing that people are mixing, for example, household cleaning products like bleach and Windex or bleach and vinegar. By the way, that should never, ever, ever, ever be done because that can create toxic gases and toxic byproducts, which can be very harmful. So those things are now coming out as people are now being, I need to wipe down everything. I need to be super hygienic. This is an increased risk. So just, I think there was like a 50% increase in one of these media reports in poison control reporting as it relates to household cleaning product issues. And then not to mention the social isolation of not being at school, not being in daycare, and then the long-term impact on the microbiome, the skin, lungs, and gut, especially in children. So I'm just posing the question. We don't have all this information yet, but based on the evidence that we do have, which naturopathic doctors have been talking about for a long time, there is potentially a very negative effect. So there may be a big spike in things like allergies and autoimmunity, which we already have had at epidemic proportions. So the question is what can we really do about this? Do we get out and eat dirt? Do we not sanitize? No, I don't think either of those two extremes is going to be reasonable. But I think that we also still need to make sure that as things are getting back open, we do need to reconnect our safely, some of our social connections. We do need to get into nature where our body normally does get exposed to some of these microbiome, these substances. We need to be cautious and cognizant of not overdoing it, especially if we have young children with some of the sanitization and cleaning products. We have to be very cautious of the exposure of these sprays, especially when the kids and children are around. So something that we definitely need to put in mind, because what I'm not seeing in the media is everyone needs to sanitize, but we also have to be very careful of the negative effects of that and the potential risks and dangers of that, both acutely and long term. And so the other obvious thing is, what do we do about it? Well, we have to leverage our old friends. And there's tons and tons of information about this, both fairly mainstream, like these two papers here, or these two periodicals, as well in the scientific research. We need to leverage our microbiome. And in fact, I would say right now is a time that we need to strengthen our microbiome. And because it's constantly being assaulted, not only for all the reasons I pointed out in my immune resilience webinar, where probiotics, fiber supports our immune resistance, but also from an immune tolerance perspective. So this should redouble your efforts on supporting our microbiome. And there's a number of ways that we can actually do this. Probably the best way and the safest way for long-term use is to be using prebiotics, which you can see here on the left side. So dietary fibers, anything from soluble fiber that you're going to find in beans, chia seeds, flax seeds. Psyllium is insoluble fiber in lots of things like cellulose and lots of vegetables. So brands, whole grains, and vegetables are your highest sources of fiber and prebiotics. Prebiotics are things that not necessarily all fiber is prebiotics, but soluble fiber is a fuel for bacteria, which bacteria will use to ferment, create fuel for itself. But you could also supplement with probiotics, and we'll talk about one that is, I think, very, very highly researched when it comes to increasing other good bacteria in just a second. But in Chantal Dumas' webinar previously last month, she talks at length about probiotics. And then finally, short chain fatty acids. There's this term called postbiotics. It depends on what literature you look at. Postbiotics can be referred to as things the bacteria produce, but also bacteria that are actually dead, and they are now being used as signaling molecules for our immune system. So our body actually can create an immune response to bacteria that it gets as a probiotic, and this can actually have an effect at killing off bad bacteria. It's almost like a probiotic autoimmune response, and that's postbiotic. So that's a little sneak peek into the future in terms of the probiotic supplementation world, is that that's going to be changing in, as we now evolve with the research. And so more and more supplement companies are looking at how do we leverage short chain fatty acids. Still, the best way right now is prebiotics and very specific probiotics. And you can see here, look at all the effects of these postbiotics and the effects on the microbiome, so balancing the immune system, as well as all these systemic effects. So really, this is going to be the future of supporting the immune system as well as our microbiome. And so just a really brief summary, as I mentioned, I'll push your attention to Chantal's webinar in April, but I just want to highlight three of my favorites when it comes to the literature. Probiotic 3 increases butyric acid, which is a short chain fatty acid. It's a postbiotic, a very specific combination of probiotics, 3 strains that have been studied together. They're gastric acid stable, they're temperature stable. They've been studied for 65 years, used in Japanese and Asian hospitals. Good evidence to show that it increases Treg cells, which regulate the inflammatory response, regulate the allergic response. I've had excellent results with patients showing that they've had reduction in food sensitivities just by taking probiotic 3 because of its effect on Treg cells, as well as more chronic inflammatory conditions like some of the research on probiotic 3 in, for example, ulcerative colitis. And also really great antibacterial, anti-gastroenteritis formulation because it does have an effect on killing off bad dysbiotic bacteria. XOS is a xylooligosaccharide. It is a prebiotic. So again, I think in combination with a probiotic, and I would consider probiotic 3 a symbiotic because it acts both like a prebiotic and a probiotic. But XOS is a smart prebiotic, which just feeds the good bacteria. Has research in kids, in pregnant women, very, very safe. Also relieves both constipation and diarrhea, and doesn't increase the kind of growth of the pathogenic bacteria, the one that causes a lot of gas and bloating. So unlike FOS, which is fructooligosaccharides, xyloligosaccharides, or XOS, does not have that negative effect. Great tasting little lozenge. I can give it to my kids, give it to your patients that are looking for like almost like a chewable option that's really, really flavorful. And then finally, a soluble fiber like hydrolyzed guar gum that you find in a formulation like Solufiber. Great research on this. This is FODMAPs friendly. You can mix this into tea every morning. You can mix it into your smoothies, water. Just adds that fiber. And we're looking at getting over 25 grams of fiber a day. So I think these 3 formulations are probably going to be the top of my list from the AOR line to support the microbiome, because we want a balance of both prebiotics and probiotics. You can take them together. You can take them at different parts of the day. You can alternate between the 2 fibers. You can alternate between different types of probiotics, which is always a good idea to give more diversity of fuel for your bacteria and microbiome. But these 3, I think, shine above the rest. So again, check out those webinars. There's both a retail and a public version of it for your reference. And then for anybody that does work with AOR, this is a great little comparison sheet that the marketing department created, just looking at all the differences and summarizing some of the key formulations that I already mentioned here, but there's some other ones here, both from the probiotic as well as the fiber realm. Okay, so that was the microbiome. Now, I did touch on social isolation a little bit, but I want to dive into it just a little bit more, because this is something that some researchers are now starting to shout, and I'm not taking a stance one way or another, but the negative downstream effects of the impact of this 2 months of social isolation may have a more detrimental long-term effect. We don't know yet. 2020 is obviously, hindsight is much, much more accurate, but based on the evidence that we do have, social isolation may have a more detrimental impact on mortality than even a viral infection like COVID-19 or influenza. So just a couple little pieces of information just to kind of highlight the impact of social isolation, which is what has been forced on everybody now. A large, this was a study looking at the American Cancer Society, and they looked at connecting social isolation and higher risk of death. And especially the associations like the Cancer Society and the Hearts Association, they're interested in looking what are some of the variables that are going to influence outcomes of their patients. And what they found is that there was an increase in mortality in both men and women, and it was specifically worse for Black men and women, and more than double the risk of death from any cause, all-cause mortality. That's like the holy grail of worst cases that you could possibly have. But this isn't like, increased risk for a heart attack or increased risk of stroke. This is dying of any kind of death, which is really, really a negative thing. And so you can see that there's a pretty big increase in that negative effect. And this is a kind of a specific graph that highlights some of this impact. So you can see this hazard ratio here. So basically this one is no impact at all. And then over one, you can see that on each specific group of people, for example, women attending only, clubs or groups less than one time a month, which would be considered socially isolated. In last 2 months, we got nothing at all. They had an increase in their risk ratio of mortality. There are certain ones, like, for example, religious services, not married, men in attending religious services and not married, or less than one time a month. You can see that they have a very substantial, over 25% increase in mortality. So this is a really, really big issue. These are pretty big numbers. In Canada, this was just very, very recently, April 27th, just a survey found that half of Canadians state that their mental health worsened. And this was, again, an Angus Reid poll showing that 44% people are worried, anxiety at 40%. There was 34% that were grateful, bored, optimistic. So it kind of mixed in the various emotional feelings. Majority of them are quite negative, 16% depressed. So this is just a survey. Just want to give you a couple other pieces of information, what social isolation does in terms of its negative effect, just to put into context. Anybody that had higher amounts of loneliness, as this is especially a big issue for elderly, or weak social connections, kind of like, for example, what I just showed you on the previous screen, attending religious services less than once a month, was the equivalent in terms of its effect on mortality as consuming 15 cigarettes a day or consuming 6 drinks of alcohol a day. Now, we would probably all agree that drinking 6 drinks of alcohol has a very negative effect. That's the same effect that loneliness and weak social isolation and weak social connections leading to the feeling of social isolation causes. Young people are not also exempt from this, especially in the world of social media. We know that increased uses of online interactions has increased the risk of depression, anxiety, as well as leading to feelings of unfulfillment and many other mental issues. And then there's lots of other stats, but those are some of the ones that I think are the most telling and the most important. So obviously this is a big issue. And so this really segues into what can we do to support our mood? What can we do to offset the negative effects of this period of time that we've had? Because now people are thinking about, all right, so how do I get back to work? Is there going to be work for me? what's the impact on my family life? Can I get back to hanging out with my friends and family? It looks like there's going to be a graduated, phased approach. So what I want to share with you is, what are some natural ways that we can support our mood, which is what we've been talking about, which is the impact of social isolation. Using natural health products, using things you can find in your diet, using botanical substances. And so the first thing we have to understand is that we have to understand the foundation. So there are neural pathways to create neurochemicals, neurotransmitters like serotonin and melatonin that are dependent on nutrients. And so here, for example, to make our happy hormone, serotonin, it does many other things in the body, including regulating our blood flow. But serotonin needs folic acid, B3, B6, zinc, magnesium, and vitamin C, all to properly be produced. If you have low levels of any one of these things, those pathways grind to a halt. And so nutrient deficiencies are a very common issue when it comes to mental health, especially as a person gets older. There's tons and tons and tons of literature showing that as a person gets older, they absorb less of their nutrients, their stomach acid goes down, their food diversity goes down, their microbiome diversity goes down, and that has all a downstream effect on their mood and on their brain function. Dopamine is kind of our motivational neurotransmitter. Iron, folic acid, B6, magnesium, and then the conversion of dopamine to via vitamin C to norepinephrine, which is again our kind of stress hormone. Vitamin C is necessary for that proper conversion. Again, I'm simplifying some of these, but just to give people an idea, our main inhibitory or calming neurotransmitter, GABA, which I'll share with you just a second, from a supplemental perspective, B6 is required. So put this into perspective as we're looking at all the key nutrients, because I'm not going to talk about all these different things. This is something that's required as kind of a foundation. Acetylcholine is our memory one. That's a huge one. B1, B2, B5, B3. Choline is a major fat phospholipid that's required for acetylcholine formation. So I've highlighted the nutrient deficiencies, which we've already talked about, but all the other things are really important. And again, don't have time to get into all of these. If you want more information on some of this, check out my Neurotropic webinar, which is the one for healthcare providers. Was done last Tuesday, as well as industry insiders, anybody that works with health food store or one of AOR's accounts. But there's also a public one, which you can also feel free to share with your friends and anybody that's in your family, talking about what's the impact of stress. I touch on hormones, gut permeability. Chantal and Dumas talks about that, and diet. I've talked about it in other presentation. So don't forget the foundations. And I already mentioned, just to piggyback on formation of all those neurotransmitters, these 4 key classes or nutrients, vitamin D, magnesium, zinc, and the B vitamin family, is absolutely essential for the production of all your neurotransmitters, but also many other things. Like, for example, I'll give you one point about each one. Vitamin D is a neurohormone. It is often very deficient, especially as a person ages, because they decrease their ability to absorb fat-soluble vitamins. AOR has a fat-soluble liquid vitamin D that's from a vegan source, so it's a lichen source. So it's a great way of getting your vitamin D. These doses, again, 1,000 IU is what Health Canada recommends. You can get it through cod liver oil, but it's really the sunshine vitamins. As the weather now gets nicer, you need to be exposed to sunlight to get adequate levels of vitamin D. Magnesium, this is my favorite mineral. So important for so many different neurotransmitter pathways, but also for mitochondrial production, so energy production. So making sure we have a good amino acid form like magnesium glycinate and magnesium malate if anybody has any sort of chronic pain. And then zinc. I'm really grooving on zinc much more lately, because we think of zinc as, oh, it's a mineral for immune function, or it helps heal tissues. It does so much more than that, and similar to magnesium, it is actually an anti-inflammatory. A lot of the research coming out is that it's an antioxidant, anti-inflammatory, and it's required as part of the the ability for neurotransmitters to stimulate and properly signal receptors. And finally, all the B vitamins, which we've talked about before. Okay, so let's talk a little bit about GABA. So GABA, everyone's familiar with it. Everyone's seen it on their shelves. GABA is an inhibitory neurotransmitter. There is some research showing that it has a calming effect. There's mixed research on it. For me, really what comes down to is that people have used GABA and they've noticed that they've had an improvement in their anxiety. And some people don't notice improvement. And there really is a little bit of variation. One thing that is interesting is that a lot of skeptics of GABA said, well, that doesn't really work because it doesn't cross the blood-brain barrier. How do you explain its action? So I just want to briefly point out is that there are transporters across the blood-brain barrier for GABA. There could be potentially blood-brain barrier permeability in cases of, for example, brain injuries, which I do a lot in my practice. But I think that there's a third reason, which actually is that our gut, our probiotics in our gut and our enteric nervous system actually is the main target for GABA. It doesn't necessarily need to get into the central nervous system because of the connection between the vagus nerve and the gut-brain connection. And so we now know that probiotics have GABA receptors. And so we also know that a lot of neurotransmitters like serotonin, GABA are produced in the gut. So I think the impact of gut is also occurring in the gut, in the microbiome. The impact of GABA is happening in the microbiome as well as in the peripheral nervous system. AOR has a high dose, high potency GABA is one of our best sellers because again, it gives you pure GABA, almost 100% pure, 99% synthesized GABA, and it is going to give you that relief of anxiety, insomnia. It's quite fast acting. A lot of people noticed a very rapid action. Theanine is another one of these amino acids. I've talked about theanine before in the context of anxiety and insomnia. It does have the ability to balance a number of neurotransmitters. So it's not just one, which is one thing I really like about it, especially in comparison to GABA. On the flip side, GABA, for those people that do find it effective, is a little bit more potent. Theanine has a little bit more of a gentle effect. You actually need to dose quite high for a lot of people. It does have research on it from as little as 100 to 200 milligrams. AOR's theanine is about 225 milligrams a capsule. Many, many beneficial effects over and above something like GABA. So that's one thing that I really, really like about theanine. It has this ability to support the immune system, and it does it by actually being a precursor as one of the key parts of producing glutathione. So we always think about N-acetylcysteine, which again, I'm a huge fan of. I've talked about in the immune resilience webinar, but theanine also contributes glutamate, which is one of the building blocks to produce glutathione. And there's research showing that just supplementation with theanine does decrease inflammation post-exercise, post-surgery, and interestingly enough, actually enhances antibodies post-vaccine. A topic for a separate webinar, but needless to say, it does have an immune balancing effect as well as a support on mood. Also, the additional benefits of theanine over something like GABA is that it is quite safe and it's effective. It's been studied in children, very little drug interactions. It's naturally found in green tea and has a very fast action. So anywhere between 30 and 40 minutes, very well tolerated. I wanted to include this neat little study. Again, this was back in 2011 showing that green tea and theanine prevented influenza infections in healthcare workers. And just seeing how this COVID-19 pandemic has negatively influenced the whole long-term care situation and frontline healthcare workers. I just wanted to put that in there. Something as simple as drinking green tea. In this case, they were supplementing with green tea catechins and 210 milligrams of theanine, and they found that the incidence of flu, which is a viral infection, similarly spread, not exactly the same, but similar kind of dynamics as SARS-CoV-2, had a substantially decreased incident rate. So again, it's some little piece of information that we can apply showing how the impact of theanines on mood, balancing neurotransmitters, but it has that immune effect as well. And that is equally relevant for holy basil. Again, holy basil, I feel probably an underappreciated herb. It's been used for thousands of years. A very sacred herb steeped in tradition. It was something that was grown in the households in ancient India. It's now commonly found in tea as tulsi, and so that you can see it as Ocimum, Ocimum and sanctum, which is the Latin name, but tulsi or holy basil is kind of the more common names. What's unique about holy basil is has kind of three modes of action. Number one, it lowers blood sugar and supports metabolic syndrome. By far the most research there. It does have antimicrobial immune balancing effects, so it has 5 human studies, and then it has effects on stress. So there's 4 human studies there. And so this is over and above all the animal studies and test tube studies. So it does have good human evidence showing its beneficial effects on, in this case, if you look here, this is neurocognition. But specifically, I want to point out in the context of what I'm talking about is stress, sleep, anxiety. Again, you can see here, depression is another one. So the term here, the category is neurocognition, but specifically when you look at it, it really is the body's ability to deal with stress. And so that's one of the best things about holy basil, as well as its effect on blood sugar. It does have effect on the immune system, so you're going to have that double whammy similar to theanine. So AOR has a standalone holy basil. It is also found in our mushroom synergy. If you're interested, that is our kind of comprehensive immune formulation with 7 different immune modulating mushrooms plus astragalus and obviously holy basil. So it's kind of like an adaptogenic immune formulation, but we have it as a high dose standalone in holy basil, 500 milligrams by itself. And I really like to think of holy basil as for people that get that kind of hangry. They're trying to they're maybe skipping their meals, or they're getting that frustrated, anxious, clammy feeling, low blood sugar feeling if they're not eating more frequently. And that does tell us some underlying issues that need to be addressed primarily through insulin sensitivity and diet, but holy basil can help address that. But it does have a nice calming effect as well. For those that have access to the professional dispensary from AOR, there is a unique product, which is one of my favorites, probably one of our most popular in the Pro line, is called Pro DeStress, and it's the combination of GABA, theanine, and holy basil. Really nice synergy for all the things that I just mentioned. And you do have a lot of people and clinicians saying that they do notice a very calming effect from taking holy basil, from taking Pro DeStress, because of the combination of all the ingredients. Plus you have that longer term adaptogenic effect. So a really nice combination. Okay, so let's switch gears into something called inositol. And I haven't talked about inositol recently at all. Inositol is a substance that is part of the B vitamin family. Some of you may notice it is in our advanced B complex ultra, and it is listed as one of the ingredients. It is termed vitamin B8. We never call it that, but it is part of the B vitamin family. And it's better known as inositol. And the best way to understand inositol is that it's a sensitizer for receptors. It supports the production of neurotransmitters and brain signaling. And it does it across many neurotransmitters, similar to theanine. So it's not like 5-HTP does a precursor for serotonin, or GABA is the precursor. Obviously, it is GABA itself, and that's the calming neurotransmitter pathway. But the really nice thing about inositol is that it is going to be applicable to serotonin, acetylcholine, noradrenergic, which is the dopamine and epinephrine pathway. So you're going to have a lot of balance when it comes to these neurotransmitters. And that gives you, first of all, a good idea of safety, and then the breadth of application. You can see that. Look at all the wide range of mood disorders. This is a 2014 study that I just cite here, looking at the meta-analysis for inositol on depression and anxiety. So this is really neat. A substance that can do both anxiety and depression, both things that are a major issue when it comes to social isolation. There are 2 forms of inositol, and AOR has multiple formulations. There's a PCOS relief formula, which is primarily myo-inositol, and myo is the form that is most commonly found in the central nervous system. one of the really nice things about inositol is that you can, especially as AORs as a powder, you can dose up slowly. And this particular study looking at 10 weeks, and then again, you're going to have an improvement of panic attacks from 10 per week to 3.5 per week just after 4 weeks of treatment. This is actually substantial, just to show you how quick the effect of inositol is. And what the other pearl from the research is that inositol is very, very successful when a person has tried antidepressants in the past and it's worked for them. So that seems to be one of the telltale signs of where inositol could be most effective. And so if you think about that, working with a healthcare practitioner in terms of weaning off, maybe the person it's working for them, but inositol can be quite helpful for that. But you need quite a bit of dosing with it, 12 to 18 grams. And 1 scoop of AOR's inositol powder is 9 grams, so it's fairly easy to get to the full dose, up to 18 grams with 1 to 1.5 to 2 scoops a day of inositol powder. Mixes easily in a lot of water, really good addition to anything like some of those core nutrients that we mentioned, GABA and theanine. Okay, I want to mention something a little bit here about methylation. We talk a lot about B vitamins. You can see B12 here. You can see the 5-MTA, so folic acid. You can see B6. This is the CBS pathway, which produces glutathione, which is a key part of this pathway. Homocysteine, we've talked about all these nutrients detoxifying homocysteine, but there's a substance called SAM right here, S-adenosylmethionine. And this is one that often gets overlooked when it comes to mood, but a lot of clinicians and old school orthomolecular docs really like SAM-E for its role in mood. We think about it as for cardiovascular health or also osteoarthritis. But because methylation, the process that I just showed you right here, what this does is that it's necessary for the formation and production of A, our DNA, and B, our neurotransmitter production for any making in the body, any production inside of our cells. It also is important for the formation of phospholipids in the brain, which again are important for signaling and structure of our fatty tissues, our neurons. And that increases the sensitivity for our neurotransmitters. So for example, SAM-E can increase serotonin, which is why it has such a good effect on brain health. And similar to inositol, has a very fast action, actually, in fact, much faster than even inositol, showed to be an effective antidepressant in as little as 2 weeks of taking SAM-E, just by supporting the methylation cycle. So again, there are side effects you have to be careful of, like with any medication. So too much of a good thing, like a risk of mania. So mania is the opposite of depression. But for people that have tried an SSRI and hasn't been effective, this can be an option for them. The best thing that is always recommended is read and follow the label as always, and increase the dose slowly until you get up to the full dose. I believe 1 dose is going to be 800 milligrams a day of SAM-E. And there you can see it right there. So that's 800 milligrams total, giving you 400 milligrams of actual ionic SAM-E. So don't discount SAM-E as a really important mood support, but people get thrown off because, as you can see, look on the box, it also says osteoarthritic pain, so they see that, but there's also mood support. So we've included both of those indications, and it is approved by Health Canada for both. Okay. Saffron. AOR has a saffron that was launched just recently, I guess, within a year. And saffron is one of these substances that the more I'm using it, the more I'm finding it to be really, really helpful and really, really unique, because we don't have a lot of things in our arsenal in the natural health product world that has a neurocognitive effect, but also has a anti-inflammatory effect, neuroantioxidant effect, and has a lot of good research on it with mood. And that's why I included saffron here, is that these are some of the actions it has. But majority of the research on saffron as it pertains to mood is going to be on depression and stress and anxiety. So this is one snippet study that I pulled out from you. So 120 patients, they reported low mood. So something similar to what you would find in that Angus Reid poll. You know, I've been socially isolated for 2 months and I'm reporting low mood because, you know, I haven't seen my friends in a long time. I haven't seen my family. I'm by myself. I'm on social media all the time. They were given saffron for 4 weeks and they noticed that there was an improvement in both sleep and mood. And so what this tells me is that you have a substance that works, again, quite quickly within a month, and that it has an ability to get into the brain and impact some of these cognitive and brain outcomes like sleep and mood. It also has the effect on the ability of a person to perceive stress. So we often think of saffron as, you know, something that's just for depression, which is there's some great research on clinical depression, postpartum depression. I suggest that you visit AOR's website, check out the research on saffron. I think you'd be very impressed when it comes to the evidence. And again, I'm using it a lot more, especially in the population that I deal with, chronic pain and brain injuries, because it has a neurotransmitter balancing effect, but also its effect as a neuro-anti-inflammatory. People that are depressed also on overeating and snacking. I did want to point that out now because that is one of the things I'm hearing with my patients is that people are now eating more. You think that they'd be eating less because they, you know, they're trying to conserve their food, but you know, people have nothing better to do. They might be eating more. Their mood is lower, so that already is linked to snacking and overeating. They're watching more TV, which has been associated with, again, more snacking, binging, eating. It's a habitual thing, and so saffron can help offset some of these negative detrimental effects as it relates to brain and kind of overeating, snacking behaviors. So AOR saffron, 50 milligrams per capsule, high potency extract, 1 twice a day, tiny little capsules, really easy to consume. Really high quality extract. The world leaders in saffron is from Iran, and there's this patented extract called Saffron, where all the research is done on. So I suggest you really consider using the highest quality saffron extract, as well as beware of adulteration. There's a lot of saffron on the market. It might be less expensive, but saffron pound for pound is one of the most expensive substances in the natural plant kingdom, you know, on par with something like gold, because you're collecting the actual, just the stamen of the actual hibiscus plants. So beware of adulteration with things like marigold. Typically you pay for what you get. So if you're going to use a saffron, I suggest you use a really good quality extract like the saffron here from AOR. Okay, so I want to conclude looking at some adaptogens. So it would be remiss talking about the stress response without actually talking about adaptogens. And so ultimately, when we're talking about social isolation, when we're talking about the impact of mood, the stress response is absolutely front and center. And the option in the natural health world, especially in the herbal botanical kingdom, is the adaptogens. You can see this is a great little graphic showing that here's our stress response in purple. Our, you know, stressor goes up, response temporarily, very briefly goes down, but then our body increases our stress response, has a very robust stress response. Cortisol goes up, epinephrine goes up, our fight and flight response goes up. Now that's great short term, but what about if that effect is happening all the time? Like I lost my job, or you know, a stressful relationship, whatever it might be, the stress response actually will continue and stay elevated. And there's these negative effects that occur with excess cortisol. One of them being, for example, a downregulation in our body's ability to store memories, disruption of sleep, increase in fat deposition around the abdominal area. So all these are kind of long-term chronic effects of the extended stress response. The red line here is the stress response with adaptogens. When adaptogens like Rhodiola and Withania, which I'm going to talk about here shortly, they attenuate or balance the stress response. And so this is an important thing to remember, one that you've probably heard about, but nevertheless important to remember when it comes to how do we offset the negative effects of something like social isolation. So some of our favorites: Withania somnifera or ashwagandha, potent adaptogen. What I like about Withania, as you can see, look at all the positive effects it has. kind of three main area constellations or loci of where the actions are. Number one, it helps decrease cortisol if it's elevated. It helps improve not just cortisol, but also the thyroid hormone. So the conversion of thyroid from T4 to T3 for inactive to active, which is one of the things that cortisol decreases. So it might be connected to cortisol there. It does have independent anti-anxiety effects. So it's kind of a great adaptogen for that wired and tired person. And it does have cognitive supportive effects. So it's, when I say cognitive, I mean it supports memory. It allows a person, especially as they get older, for the brain to function better, and supports neurotransmitter production, reduces depression. So this is a quick little study again, just to showcase what I've already talked about. So we'll just briefly skip over it. But again, look, you can see here, these are 3 different questionnaires showing ashwagandha really at a substantial decrease after taking it compared to placebo, double blind. And then finally, you can see salivary cortisol went 30% decrease after, again, stress, the high stress and anxiety compared to placebo. So does have quite potent effects. It also has the additional benefit of reducing emotional eating, similar to saffron, lowering inflammation, and increasing testosterone, especially in males. So there is a connection. We think of, ashwagandha, oh, it's just for females that are stressed, postmenopause, for example. That's one of the big categories that use a lot of our ganda formulation. But it does also have this ability to support testosterone. So it's almost counterintuitive, but has these balanced kind of more wider spread, or in the literature the term is called pleiotropic. It does multiple mechanisms of action. One of our best sellers in all of AOR's line is the Ganda 600, just a high potency, high quality extract of ashwagandha. Most of the research actually is looking at 300 to 400 milligrams of ashwagandha. There is research looking at some of the higher doses. I think that the real unique part of why Ganda 600 is so popular is that it's very effective at this high dose. Great standardizations to the 2 active components, and obviously beware of some of the cautions. First caution always is too much of a good thing. Well, if I'm on sedative medications, you don't want to be sedated any further. Some people do notice they're a little bit more kind of calmer and tired, so maybe you might have to play around with it. Most people are fine with taking it at any point in the day, but some people prefer to take it later in the evening because it has that kind of nice calming effect. Rhodiola rosea. Siberian, we think of it as kind of like a Russian ginseng. It's not Siberian ginseng. That's a separate one. That's the Eleutherococcus. Think of rhodiola for mental and physical focus. This is the big claim to fame when it comes to rhodiola. But it's not just on that. It also has this ability to balance cortisol. It has this ability to support binge eating. I specifically chose herbs, saffron, rhodiola, ashwagandha, that has also this impact on this excessive food consumption, because that is a huge issue right now as people are, at home, and especially as they're getting back to their normal as it's going to be, is that they're going to have this ability, they are going to need this ability to regulate their food intake. They might want to lose weight, and rhodiola, ashwagandha, and saffron can be quite helpful. So think of rhodiola for mental fatigue. I'm also going to put in there as a neuro-anti-inflammatory. This is one of the common things that a lot of these adaptogenic formulations have as an effect. It does have this really unique effect of, if you're doing low doses, it may actually be more stimulatory, and high doses, like for example, this is 340 milligrams a capsule in the standalone rhodiola, but we have a lower dose that is found in OrthoAdapt. There's the lower dose that's found in the rhodiola plus Panax ginseng, which is a separate formula. But the higher dose kind of has a little bit more of a calming effect. It's a very fast acting herb, as I'm going to show you in just a second, both hourly, but also its effect on kind of longer term outcomes like cortisol. It also has a nice anti-pain effect. So rhodiola has a good anti-inflammatory effect. So let's not discount that. I love this study. It's from 2007, so a little while ago, but just showing again how quickly cortisol can change just after 7 days of use. You can see rhodiola here is in the blue bars. And then you're going to see other ginsengs also have a very, very acute effect versus placebo. So who says herbs can't have a very fast acting effect? And then I want to throw this in here just for a little curveball. Curcumin, which we often think is an anti-inflammatory, does have an anti-anxiety effect as well. You can see here, this is AOR's Curcumin Ultra. It uses a patented extract called Curcufen, which is fenugreek fiber, and it's impregnated with a curcuminoid complex. A really, really advanced formulation using only water-soluble techniques, no solvents whatsoever, with an extremely high brain bioavailability because it provides free curcuminoids. But we often don't think of curcumin as an anti-stress molecule. We have to now should be considering it. Curcumin Ultra, because it has this ability to get in the brain. We know that a lot of things like depression, anxiety, these stress responses, they're modulated through inflammation. They're modulated through free radical damage. This is exactly what curcumin is excellent at addressing. So you can see here, I love this study because it shows placebo actually symptoms like anxiety and stress were the same, or just actually might have even increased. Then you're going to see just a standard curcumin. So just taking plain old curcumin is going to have a positive effect. It's probably not going to get through the blood-brain barrier, but it does have a positive effect on the gut microbiome. We do know that one of the impacts of herbs is modulated, maybe not directly getting into the blood-brain, getting past the blood-brain barrier and getting into the brain. And we have to almost get out of that mentality sometimes, because that is a very pharmacological way of like, can it get into the receptor? That is one way of thinking about it, but look at the drastically improved ability to decrease symptoms with the curcumin glucomannan complex, which is what curcufen is. So what's in Curcumin Ultra? A substantially improved reduction in fatigue, anxiety, and stress, plus all the improvement in glutathione peroxidase, GST enzymes, SOD2, and other inflammatory markers. So really, really kind of neat clinical pearl. Use curcumin for anxiety and stress. So in summary, we have talked about a lot of kind of great formulations, OrthoAdapt and Advanced B Complex Ultra. So foundation plus the combination of adaptogens, it would be a great one for fatigue. And then you can look at anxiety, depression. There's many options. We've talked a lot about them. Theanine, saffron, all the adaptogens, rhodiola and ashwagandha we just talked about. But consider always the foundations: zinc, magnesium, omega-3s, vitamin D, and Bs, plus some sort of botanical or nutrient amino acid intervention. You can see some of them written out here. The cortisol calm is a formula that's coming in the future, so ignore that. I've kind of kept that in there, but cortisol calm is a formula that's coming out in the future. It is not out yet. Okay, so in summary, theanine, GABA, DeStress, holy basil, inositol, saffron, curcumin ultra. This is going to give you your foundational mood support, and it gives you a little bit of a summary here. At this point, we're going to open it up to questions. So I'll turn it over to Dr. Nirat. So thank you so much for listening, everybody. And I'm going to try to get to everybody's questions. So please put them into the question box, and we're going to get to all of them.
Thank you so much, Paul. That was incredibly informative, and I think obviously very timely. So we have a few questions rolling in, but I actually just wanted to start off with, you had mentioned kind of some of the risk factors for the social isolation and how that's really increasing. Are you aware of, were any of those studies with complete isolation? You know, obviously we're coming out of this and people have been trying different mechanisms of kind of having those virtual connections.
Yeah.
Could you maybe speak to that? Like,
Yeah,
you know, how are some of those impacting us?
that's a great question. And I know people have been doing their best. I mean, I'm myself included, for, you know, staying connected through technology. And I think it's still, from what I've seen, it's still too early to tell, you know, is my Zoom meetings with my family going to have the same effect as we are going to see them in person? I mean, I suspect that it's probably going to be better than nothing, but it may be not as good as actually seeing it. You know, there definitely is, you know, this idea that using social media more whether it's Instagram, Facebook, and people have been using those for good things, for connecting for a long time, well before this, there still is an increased risk, an increased incidence for mental health issues when you have higher uses of social media. So we don't know exactly of just like, having a Skype or having a Zoom call, but I think that the research still has yet to be done on comparing all those. But I did want to make the point to your first part of your comment about, was this total isolation? From my understanding from that research, isolation is a parameter. I don't think they're looking at necessarily like prison style, social isolation where you're not seeing anybody at all. But I think they're referring to, less, a couple interactions, or more importantly, the person themselves would state that they are actually lonely. And so that's almost like a self-reported loneliness that they've kind of correlated to, and try to put some endpoints on, like, they go to church once a month, or they only go to one club meeting a month, or one sports event that they're participating in. So I think that there are ways of quantifying that, but I don't think it was total isolation, not seeing anybody, which some people, unfortunately, that's what they had to deal with in the last couple months.
Yeah, absolutely. I think everyone had a different manifestation of this. Um, actually, just to shift gears a little bit back to the microbiome, I know a lot of patients have been asking me, and maybe you can speak to this. What is the process of do you kind of switch out your types of probiotic strains every few months, or are you consistently kind of, I know you spoke a lot about prebiotics, but
Yeah.
do you have any recommendations on cycling or timing of probiotics?
Yeah, you know what? I think this is a great question that Chantel addressed in her webinar, but I will briefly address it because it's an important concept. First and foremost, when it comes to the microbiome, you got to have both prebiotics and probiotics. I think this is something that I probably wouldn't have said maybe 5 years ago, and really there's been an explosion of research on prebiotics and short chain fatty acids and all the influence of these positive beneficial metabolites. To get some of the beneficial effects, you need to cycle probiotics. And so I mentioned briefly in the beginning part in the section about the microbiome is that, probiotics, most times you take them away and you stop supplementing them, the effect doesn't last. And so that is something important to understand, because what that's telling us is that the bug itself is doing something, then it's not really changing the microbiome long term. Think of probiotics, whether they're alive or dead, it doesn't matter. They do have a receptor, they do have a signal that the microbiome does sense. Now, when you look at strains that are alive and active, they might have additional beneficial effects like probiotic 3, where they have an improvement, not just on, like, I'm giving you tons of lactobacillus, which is one of the main probiotics or main bacteria that's in our large intestine, but I'm actually giving you a substance. I'm giving you a probiotic that's not meant to compete or add to the numbers, but it's meant to change the terrain and almost fertilize, which is why I'm such a huge fan of probiotic 3, is that the concept is totally different than just doing massive 50, 100 million, per capsule. But I still think, nevertheless, to answer your question, it doesn't matter what type of probiotic that you should be taking, you should be kind of changing that every couple months to get all the different beneficial effects of various strains.
Yeah, I love that point. I think, I always liken it to, you want to reseed that fertile plot of land in your gut with, plants and trees that are going to grow and produce more fruit, instead of just throwing a bunch of probiotic strains on a field and hoping for the best, right?
Yeah, for sure.
Um, and actually, I recall in another one of your webinars, you spoke about vitamin D and the importance of retesting before kind of supplementing blind. Could you just speak to that a little bit more about the importance of,
Yeah,
moving forward? I think a lot of people are.
one of the things here. Yeah, as I mentioned before, I've talked about this before. Vitamin D is one of the things that, it cannot be You cannot underestimate the fact that just because you had one test and you show that you were low doesn't mean that your levels are going to go back up. I've seen this oftentimes. Like I've used high doses, and as a clinician, I can recommend high doses because I have prescribing rights, and patients are still low after retesting. Sometimes they're normal, but you just can't assume. So I recommend always double testing to see if what you're doing. You have to have an evidence-informed approach, and that is one way of collecting real-time information on that person. There are many things that are competing for the absorption of your fat-soluble vitamins, like vitamin D. For example, as you get older, which this pandemic has really negatively impacted the long-term care homes, your ability to absorb nutrients goes down. That's well documented. Anybody that has any sort of inflammation of the gut, like for example, celiac disease or something, even something as like, non-celiac wheat sensitivity, there's inflammation that's occurring and you're decreasing the body's ability to absorb these nutrients. So you definitely need to have a retest. And, I think vitamin D is one of the core things that should be in place when you're addressing mood, especially when we're talking about the immune system. Like, there's tons of information now coming out in the mainstream medical journals. I just looked at one thing this morning on vitamin D on Medscape. Could vitamin D be a solution or part of the solution when it comes to supporting our body's immune resilience? And, doctors are starting to really talk about this. Just because you get exposure to the sun doesn't mean that you actually have adequate levels of vitamin D. That has also been well documented in the research. So a lot of factors to consider, and definitely need to be tested and then retested to make sure that you're taking the right amounts and they're actually getting into your body.
Right. Okay, and then just shifting gears a little bit, is ashwagandha and rhodiola safe to use in healthy children for emotional or binge eating issues and related to stress?
Great question. I think I'll put my AOR hat on here and say, obviously, it hasn't been specifically studied in that age group. Neither has Health Canada, approved, anybody saying that it can help that. I think in the context of a naturopathic doctor within that patient visit, I would probably assume that you can work with somebody that will guide you in that, and that there could be some way of creating an application that is going to be safe and tolerable for those two herbs. In general, those herbs are very well studied. Their safety profile is very, very good. So I think that they probably, if any of the adaptogens, they would be, top of the list. But I haven't really, I'm trying to think right now, and I haven't seen research with ashwagandha with kids. The one caution always is that when you're impacting hormones, especially as you're in children, you have to be careful with some of the growth and development. So that's why I think that those cautions are there.
Yeah, and I think also always we look to the supplementation as a piece of the puzzle and something so complex, binge eating and stress. Okay, so it looks like we're kind of at the end of our line. Thank you so much. That was incredibly detail rich. Of course, this has been recorded, so if anyone needs to go back and scribble some of the notes they missed, I know I will be. You can do that. If you have additional questions, you can email them to marketing@aor.ca. That's marketing@aor.ca. Our next webinar is coming up on June 9th. It's going to be 12 p.m. Eastern Standard Time. And Dr. Urkel will be talking again about chronic inflammation, disease, pain, and more. If you have not registered yet, you can sign up at aor.ca/webinars with an S/B, the letter B, the number 2, the letter B, so B2B. And as Dr. Urkel mentioned, that is the business specific one, so you get a little bit more information, so you can sign up there. Thank you for taking time to join us today, and we wish you a wonderful afternoon.